Returning to running after injury can be a challenge. The type of injury and severity of the injury are the key players in how long it takes for our patients to return to running. So what do we look for with patients who want to return to running? Firstly, we want to ensure that there's no swelling in the joint. We want to ensure that they've got full range of motion in the joint and that there's no signs of instability around the joint. So things like clicking, locking, giving way, or self-reported instability from the patient. We also want to ensure that the joints surrounding the injured joint have got good strength and good power. So if we're looking at knee pain, for example, we want to ensure that the hip is strong and can tolerate the forces of running. So once we're happy that our patients have achieved these goals, we then look a little bit more functionally. So things like, can our patients balance on one leg for 30 seconds? Can they squat? Can they do knee dips on one leg? And can they calf raise on both legs and one leg for a substantial amount to be able to tolerate, again, the forces of running? So once we're happy with our objective assessment and our functional assessment, we can start to look at a return to running program. Now, a return to running program, we need to find out our baseline for the patient. What distance or what time can they run before they start to experience pain? Now, this is likely going to be different from what they previously did, depending on how long they've been out from injury. So if they've only been out for 2 to 3 weeks, baseline is probably going to be fairly similar to where they were before. However, if our patients have been out for 2 to 3 months or they're post-pregnancy, then it may be a much longer task in getting them to return to running. Our sort of key indicators of what's appropriate for returning to running is that they're not experiencing a lot of pain or flare-ups of their symptoms, so lots of increased swelling or joint stiffness. And then the big sort of key question is, should you run through pain? Now, it's a debatable one, but the obvious answer here is probably no. And is it worth the risk? So unless we're talking elite level athletes who need to compete in an event, the risks versus the benefits probably aren't worth it. So the answer to should we run through pain is no. An occasional twinge or a little bit of discomfort that lasts for a few minutes is probably okay when we're on a graded return to running program, but we don't want to be pushing our boundaries too much when it comes to trying to get back to run. If it's for a 5k, a 10k or half marathon training, we need to stop and look at our training program, look at strengthening the surrounding structures and modifying our training. Do we need further rest days in there? Do we need to look at pull-based activities or reduce weight-bearing activities like cycling?